Good morning. Imagine being 35 years old. You are happily married, you have two small children, and then you get the kick in the stomach. You're diagnosed with stage 3 breast cancer at age 35. This happened to Kim Bowles from Pittsburgh, Pennsylvania. And she has taken her story public to warn others. And I am going to share her story with you to warn all of you as well about what happens when doctors don't listen. Kim made the decision to have a double mastectomy. She told the doctors she was not interested in reconstructive surgery of her breasts. She wanted to, as they say, go flat. Okay? Going flat means basically all of the breast is removed and you are left with a flat chest with very little scarring. This was her choice. And her choice, unfortunately, because of her doctor, her plastic surgeon, it wasn't listened to. Kim was mutilated by a plastic surgeon, even though she was very clear about her wishes. She even took her husband to her consultation with the plastic surgeon. She said, I want to go flat. I don't want fake breasts. I don't want reconstructive surgery. I want my breasts removed. I want to be flat. So she had the double mastectomy. And as she was going under anesthesia, as she was falling asleep, she heard the plastic surgeon, Dr. Stephen Bernard, say, well, you know what? I'm going to leave some extra tissue here in case she changes her mind. Does that sound familiar from our show yesterday? Doesn't that sound familiar about the doctors who told me they wouldn't tie my tubes and permanently sterilize me so I wouldn't need birth control because I was going to change my mind in their opinion, which I never did. Never changed my mind about wanting kids. But oh, they were so sure that now I am at risk for all the effects of the birth control I was on for 30 years altogether. Birth control pills and Depo-Provera. I am at risk to go blind and all the other crap because they were so sure I was going to change my mind and get with the program and have a baby. Well, that's the way they treated Kim Bowles as well. When interviewed, this plastic surgeon had the audacity to say, well, 90% of my practice is breast reconstruction after mastectomy, and we want the patient to feel whole after her surgery. Well, what is his definition of whole? And again, we're talking about a man here, right? Let's get with the real program here. A woman who doesn't have any breasts isn't a woman, right? Isn't that what we're told? Isn't what we have been told by society our whole lives how important our breasts are? The bigger, the better. Now, I do know some really horrible men who, when their wives had mastectomies, they left them. Yeah, you're not a woman anymore. You don't have breasts. Well, that's on them. But for a physician, a medical doctor, to ignore the wishes of his patient because of what he perceives as a normal woman, as a whole woman, having her boobies like at least a B or a C, that is unacceptable. In Miss Bowles' records, her medical records, it states, and I'm going to quote this because it's important, what she told them at her 3 consultations she had with this plastic surgeon, with her husband present, which shouldn't matter, but he was there. She wants a smooth, flat result on her chest. And she also did not want to have to go through multiple surgeries, which happens after a mastectomy if you want reconstruction. It's just not once and done. Miss Bowles wanted one-time surgery, done. That's it. I have spoken to some women who have had mastectomies and had the reconstruction. It's excruciatingly painful. Don't let them tell you it's not. I had always thought that when they do the double mastectomy, they also do the reconstruction at the same time. Not always the case. And from those who have chosen to do reconstruction, they say the most painful part of breast cancer surgery is not the mastectomy. It is the stretching of the breast tissue to make room for the implants. Kim Bowles didn't want that. She didn't want multiple surgeries. Now, sadly, because this Dr. Bernard made a decision for her against her wishes, explicit wishes, I want to be flat. She even showed him a picture of what she wanted to look like. And instead, he mutilated her body. And now, because of what he did, she is going to have to undergo more surgery, which she didn't want. You know, she's already gone through the most horrific experience of her life. Breast cancer at an age where most women don't even get mammograms annually. 35 years old, stage 3 breast cancer. Double mastectomy, surgery. We've said surgery is risky. She said, I want one surgery and done. She went through chemo, which we all know is poison, and ain't no day at the park. Now, because of this doctor's attitude about what a woman should be if they're going to feel whole, she has to now have more surgery to correct what he did. She was perfectly willing to be flat. But she can't go living with the damage he did to her body, with what she looks like. And I'm going to give you a heads up here. On my Facebook page, I am going to share the pictures that Kim has shared. They are graphic. I mean, I would not call them obscene in any way, but they're graphic. They show what her breasts look like after Dr. Bernard got hold of them. And then they show another picture of a woman who actually had a good surgeon and went flat. So you can compare the two pictures yourself. That will be up after this show airs. Kim actually protested the Cleveland, Ohio hospital that did her surgery and Dr. Bernard by actually taking her top off and sitting in the lobby to say, I want to talk to somebody. And instead of somebody coming and talking to her, they threatened to arrest her if she didn't put her shirt back on. What Kim wants isn't money, although I do believe that Dr. Bernard owes her money because she's going to have to pay out of pocket because insurance is going to consider this cosmetic surgery. But she has to fix what this doctor did to her against her wishes. She has to fix it. Because if you look at the pictures, I would not go through the rest of my life looking like that. What is it with these mostly male doctors who believe that they know better than we do, the patient, what our bodies should look like? I submit to you, and I'm actually going to reach out to Kim and see if she might even watch this show. I'm going to try to find her online and see if she'll watch this. And I hope she does. But I would like to know that if Kim Bowles was a 65-year-old or 70-year-old breast cancer patient, if the plastic surgeon would have done what she said, go flat. Where do these doctors get off telling a woman what she should look like, what should make her feel whole. Kim wasn't a shallow, vain person. She didn't care that she was going to lose her breasts. She wanted to live, to have one surgery, to beat cancer and raise her family. Her husband didn't care if she had a double D or a C breast cup. He wanted his wife alive. And now Kim has to undergo anesthesia yet again, always a risk. She has to get more painful surgeries because of this Dr. Bernard, whose job, by the way, like the OBGYNs I talked about yesterday, whose job is to deliver babies. So when a woman comes to them and says, I never want any babies, they're like, oh no, dear, you need counseling. You'll change your mind. I'm going to deliver a healthy baby for you one day. No, you're not. See, your beliefs are not my beliefs. And your attitude about what a woman's reproductive organs are about are not my beliefs, or what I believe reproductive organs are for. Just like Dr. Bernard had no right to make a decision for Kim Bowles about what a woman should look like, even if she has breast cancer. There are many women out there who, because of what society tells us about what our bodies should be, have done horrific things through plastic surgery to their bodies. There are women who have actually died of breast cancer because they refused to have their breasts removed. That's how attached they are to their breasts. Personally, my husband and I have had this discussion. He knows full well that if I get breast cancer, they're coming off, and I'm not going through 3, 4, 6 surgeries. I'm not having nipples tattooed on. I'm getting them cut off. I'm going flat. And you know what? It's not going to bother me at all. And it's not going to bother my husband. We've already had the discussion. You know who it will bother? When I walk on the beach in a bathing suit and I don't have breasts, people will feel uncomfortable. Oh, what happened to her? Oh, she buys her bathing suits in the children's department. So what? Why should I put myself through multiple surgeries to make other people feel comfortable? And who the hell do these people think they are to define what a woman looks like? I don't care if you have MD or plastic surgeon or surgeon next to your name, or you're making $800,000 a year. When I tell you what I want, and when what you're going to do doesn't threaten my life in any way, you do it. Because you're not the one who's going to be looking at my body every night. I'm not having sex with you. If you find that making me flat makes me sexually unappealing to you, Dr. Bernard, well, guess what? I'm not your wife. When your wife gets breast cancer, then you have the right to do whatever the hell you want to your wife. But you don't have the right to do it to me or to Kim Bowles. You don't have a right to use your opinion of what a woman should look like and then put this woman at risk now that she has to go through more surgery because you didn't listen. Political Paula, out.